So to begin, we're going to do pronation, range of motion. So I'm going to have my patient abduct their shoulder like this, keeping their wrist neutral position. And what I'm going to have them do is start just like this, keeping their elbow tucked to the side. I'm going to find the access point, which is the dorsal proximal ulnar, which is right here on the styloid process. The stable arm is going to be right here along the mid-humerus, and then the movement arm is going to be the dorsal wrist parallel to the styloid going down. So what I'm going to do is I'm going to put my goniometer right here. I'm going to have my patient slowly start to move their hand over, keeping the elbow still tucked to the side. So go ahead and pronate all the way. Starting at 0, I'm going to move this over to see how far they can go. The normal range is between 0 to 80 degrees. Go ahead and relax. And my patient was able to get to 81 degrees. For elbow pronation, muscle manual testing, I'm going to have my patient fully pronate their arm over, keeping the elbow tucked to the side. I'm going to hold the olecranon process under the elbow. I'm going to be pulling on their wrist towards me while they are trying to fight that force by fully pronating their hand again. So I'm going to start pulling. Go ahead, fight me, fight me, fight me. Go ahead, relax. I was able to put maximal force on the wrist while they were able to fight it, so I would grade him as a 5. So for gravity minimized manual muscle testing for pronation, I'm going to have the patient rotate their arm, abduct it at 90 degrees, flex their elbow 90 degrees. I'm going to have the palm facing the patient, and then I'm going to have them slowly rotate their hand by pronating it this way as far as they can go, and then I'm going to bring it back. So they were able to go full range of motion, gravity minimized, so I'm going to grade them as a 2. So for range of motion on wrist flexion, I'm going to have my patient rest their forearm on the table. I'm going to have them rest their wrist just like this, looking for the access point, which is the lateral trochanterium, which is the bump on the side of the thumb. The stable arm is going to be going along the elbow, going along the radius over here all the way to the elbow. The movement arm is going to be parallel down the 5th metacarpal all the way to the pinky. So what I'm going to do is have my patient start right here. Going to get the stable arm on the axis, and then I'm going to have my patient slowly move their hand down as far as they can flex. Measure the range. Now the normal range is 0 to 60, but my patient was able to get to 65. For wrist flexion manual muscle testing, full gravity force, I'm going to have my patient resting their forearm on the table. I'm going to hold down their stable arm right here on the distal part of the humerus. I'm going to have the patient fully flex their hand, and then I'm going to grab the palm of their hand, and I'm going to pull on it while they're pulling on their wrist by flexing it. So I'm going to start pulling. Go ahead, fight it. Go ahead, relax. So he was able to hold the full force of my hand, meaning that he would be graded a 5. For gravity minimized wrist flexion, I'm going to have my patient in neutral position resting on a table, and then I'm going to have my patient fully flex their wrist, keeping the humerus and radius completely still. So go ahead and flex it as far as you can. Good, go ahead, relax. So my patient was able to fully move in the range, meaning that they would be graded a 2. Now for the range of motion of the thumb carpo-metacarpal extension joint, I'm going to find the access point, which is the palmar proximal part of the thumb. So right here, the highest point on the thumb. I'm going to find the stable arm, which is going along the radius down the humerus, which is called the ventral midline. And then the movement arm is actually going to be the ventral midline of the first metacarpal, so going up right here. And the normal range for a patient would be 0 to 80 degrees. So I'm going to have him supinated right here. Find the access point, start, with a full relaxed thumb. And I can't start at 0 because the patient has to have the thumb in neutral position, meaning that it's going to be relaxed a little bit. So now I'm going to have the patient fully flex their thumb just like this, giving like a thumbs up. I'm going to follow it. So now I started right here at the 30 and they went all the way up to 60. So their range of motion is 30 degrees. So for the manual muscle testing of the thumb metacarpal extension, I'm going to have my patient supinated, relaxed just like this. I'm going to have them fully extend their thumb like they're giving a thumbs up. And I'm going to hold their palm down right here so they don't compensate for anything. And then I'm going to fight on the proximal part of the thumb right here. So when I'm pushing, they're going to fight it, all right? So go ahead, fight it, relax. So they were able to fight the full force of my hand, so I would give them a grade 5. For manual muscle testing of the thumb metacarpal extension, I'm going to have my patient at 90 degrees with their elbow bent. I'm going to have their hand up, their hand relaxed, and then I'm going to have them slowly extend their thumb out, having gravity help them relax the thumb. I'm going to have him bring it back up. Now I'm going to palpate right here outside of the thumb to feel for a contraction. So as he comes down, I feel that. I'm going to tell him to relax. So he was able to go through the full range of motion, so I would grade him a 2.